Good evening. Welcome to St. Clair County's daily briefing here at the EMA office. Once again, joined by Chairman Mark Kern and our good friend Sam Bierman. And Sam's a number lady, and I'm looking forward to the day that you walk in here and say, no numbers.
I'm looking forward to that day as well. Unfortunately, that day is not today. As we have done in days past, the numbers that we will be reporting to for St. Clair County are St. Clair County residents that have been tested. As of today, we are at 1,432 residents that have been tested with 342 positive test results, which is an increase of 15 since yesterday. And that includes both males and females from the ages of 20s all the way up to the age of 90s. We have 999 negative test results with 91 test results still pending. And we are at 19 deaths, so no new additional deaths today. For state totals, we are at 173,316 that have been tested, with 36,934 positive test results, which is an increase of 1,826 since yesterday. And we are at 1,688 deaths, which is an increase of 123 since yesterday. And as always, our sympathies go out to the families who have lost loved ones to this virus. Hospitalization numbers for hospitals that are in St. Clair County. We are at 61 patients that are hospitalized due to COVID-related reasons, and 7 of those patients are on ventilators. Long-term care centers in St. Clair County that are in outbreak status, which means that they have 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, are Brea of Belleville with 12 positive cases and 1 death, Colonnade of O'Fallon with 2 positive cases and no deaths, Four Fountains in Belleville with 21 positive cases and 1 death, and Memorial Care Center, which has 14 positive cases and 1 death. And we have quite a few things to touch on today. So the next thing that I am going to move into, as we have talked about recently, are our testing sites that we are going to be having in St. Clair County. And with the cooperation of the state of Illinois, state and local elected officials, as well as Touche Regional Hospital, Southern Illinois Healthcare Foundation is pleased to announce 2 additional COVID testing sites. As we know, we already have 1 open in East St. Louis, and that location is at 100 North 8th Street, which is the Windsor Medical Building in East St. Louis. The second, which will be opening on Thursday, April 23rd, which is today, will be at 7210 West Main Street in Belleville, and collections at the Belleville location will take place Monday through Friday from 11:30 a.m. to 3:30 p.m. And the third location, which will open Friday, April 24th, will be a collection site at 2166 Madison Avenue in Granite City. And that collection site will also be open Monday through Friday, 11:30 a.m. to 3:30 p.m. And the way the screening process will go is there is a phone number that you can call from 8:30 a.m. to 4 p.m. And that number is 618-646-2596. And you will be screened by a Southern Illinois healthcare provider, and that will involve questions regarding what symptoms you currently have, possible exposure to someone who is COVID positive, your age, your work environment, and if you have any underlying health conditions. If you are determined that you meet the criteria to be tested, you will be given a time frame and which location to go to, and you will arrive at the time and the location that they send you to, and you will be able to be tested. If the caller does not meet the criteria to be tested, you will be given information on self-isolation and staying home if your symptoms worsen, and what to do if your symptoms do worsen. So we are very excited to have all 3 of those sites up and running by tomorrow. And again, that screening number is 618-646-2596. The governor's press conference that happened today, if any of you had watched that, you will know that there was a change in the situation with face coverings. Beginning on May 1st, individuals will be required to wear a face covering or a mask when in public places when they cannot maintain 6 feet of social distance. Face coverings will be required in any public indoor space, such as stores. The new requirement applies to all individuals above the age of 2 who are able to medically tolerate the masks on their face. And one final note before I turn it over to Chairman Kern is we have given a shout out to a lot of our frontline workers, police, first responders in general. But I would like to acknowledge some of the people behind the scenes that are, getting the job done so we can continue to do our job. I would like to thank St. Clair County Information Technology Department, Jeff Sandusky, who is our IT director, Chip, is our IT operations manager, and all of their staff. Without their help, we wouldn't be able to do all of the online tracking that we need to do, get into all of the programs that we need to do. So big thank you to them for keeping us up and running, as well as to the Public Building Commission staff who helps us when we get our deliveries of PPE. They send over their Bobcat, which is huge for us, so we don't have to unload them by hand, and we certainly appreciate it. So thank you to you guys. You make our job a little bit easier, and we certainly appreciate it. So now I will turn it over to Chairman Kern for his update.
Thank you, Sam. Very good. So we've seen an increase in testing sites in St. Clair County. The only way we're going to get through this and see the other end of the curve is if we continue to test, find out where people are, make those contacts so that we can stop the spread of COVID-19. Representative Hoffman was on yesterday, talked about how he is ramping up or helping to ramp up not only the testing but the contacting of individuals that people have been in contact with who have been diagnosed COVID positive. So that's an important thing. Remember to keep your diary of those close contacts you've had along with dates. And testing is loosening up. And so the more it's loosened up, the more people get tested, the better off we're all going to be. And also the state is working on adding another testing site in St. Clair County. So pretty soon we're going to be ramped up. Testing is the key to getting to the end of the road with this virus, and so that's what our officials are ramping up to do, and it seems to be working. You've seen in the local media, and I have a press release from the St. Clair County Health Department, local drive-in movie place that we're all familiar with, said that they were going to open up and that they had the blessing of the health department. That wasn't the case. The health department only is giving recommendations as they coincide with Governor Pritzker's executive order. That order says that non-essential businesses will remain closed for the duration of his executive order. At the time, it was April 30th. I believe that got extended today. The executive order also talks about until April 30th, and I believe it's extended also, people getting together in groups of more than 10 is not acceptable. You've got to keep those gatherings down below that level to avoid the spread. So no matter what you read, the health department did not give the green light for a non-essential business to start operating. We operate with the government, with the executive order of the governor, and he is going by the recommendations of the medical community. That's the key in all this. Let science solve this issue. They're the only ones that can tell us when it's safe to go out and resume our normal lives, and until they do that, we're going to have to continue to go by the rules if we're going to expect to get rid of this highly contagious virus that has now infiltrated our community. Yesterday I got a call from Scott Luchtefeld. He's the president of the Southwestern Illinois Central Labor Council, AFL-CIO. He, along with Tatsi Bailey and Dean Webb, both labor officials from the area, have come up with an idea to provide snacks and other items, drinks for all of the workers that are in our hospitals. So the doctors, the nurses, the support staff, they're hungry, and they said that they at times they just need something to grab to keep their energy going throughout the day. So they've come up with a program called Snacks to Go to fight COVID-19. Labor cares about healthcare workers, and they're asking for either donations of individually wrapped items or they have formed a GoFundMe page. So we'll be posting that, and I would hope that you would go to it, read their announcement, and any help you could be would help our healthcare workers, and they deserve our gratitude, they deserve our thanks, and certainly they deserve a little bit of love from our pocketbooks to be able to help them in this tough time. Today, we're joined by Dr. Jeff Schaefer. Jeff is the Emergency Room Medical Director, EMS Coordinator for HSHS St. Elizabeth's Hospital. Welcome, Jeff.
Oh, thank you, Chairman Kern. Thanks for having me.
So, Jeff, let's just start out. Tell us, you've been around for a long time in this business. You're a professional. You're one of the top dogs. Tell us how the emergency room environment has changed during this pandemic.
Oh, it's been quite dramatic. Obviously, in our lifetime, we've never seen anything like this. Most recently, since the pandemic has started, our volumes are actually down, which is somewhat of a concern to us, but we have had a number of changes to the internal flow process. Unfortunately, we can't allow visitors, which I know is a terrible strain for our patients and their families at times. We've had to set up the tent out front, which I think everyone is familiar with. The tent, by the way, is not for drive-up testing, as the other locations mentioned were, but what happens whenever a patient chooses to come to St. Elizabeth's, they'll be screened at that tent, and anyone who potentially has COVID-related symptoms will go through a different physical path through the emergency department than those who clearly have another reason for being in the emergency department. So we are concerned, as Dr. Anjan has said yesterday, that a number of the patients' heart attacks, strokes, for example, that we're seeing currently is much less than what we've seen in years past, and there's really no explanation for that. We're quite fearful that members of the public are staying home unnecessarily with these life-threatening conditions because of fear or hesitation from some other reason for coming to the emergency room. So I do want to emphasize that we do have processes and procedures in place to minimize patients' exposure to COVID-19 at the hospital. And we absolutely want you to seek medical attention if you may be having a non-COVID related emergency.
So the long-term effects of not getting to the emergency room right away when you have heart issues, stroke issues, or even an appendicitis, they're catastrophic. I mean, there are some things you will never recover from if you don't go to the emergency room. The emergency room is safe.
That is quite right.
Everyone to come there, and that is a message you're putting out.
Absolutely.
And so tell us about, so you not only segregate people, but you have certain operations in the hospital that shield people from COVID-19. Can you go into that just a little bit?
Absolutely. So first and foremost, we have designated rooms for potential patients or patients that potentially may be suffering from COVID-19. Patients will immediately receive a mask regardless of their chief complaint, COVID or not COVID related. The patients who potentially have COVID-19 are segregated into different physical areas of the emergency department, specialized rooms that are set up for these airborne viruses. And then, as odd as it may be, whenever you see us as providers and the nursing staff and the techs, we will have gowns and gloves, we will have masks on. It will not look like it typically does whenever you come in for influenza or another complaint. But we keep ample supplies to maximize the barrier between a potentially infected patient and ourselves, and consequently between ourselves and another patient.
So we heard earlier labor is raising money to bring snacks to the emergency room. I think that is meant to try to alleviate some of the stresses that are going on there. Can you talk about doctors, nurses, other people, including the cleaning staff, the stresses that have been added on to them?
Yeah, certainly. It's unprecedented in our career, certainly. Counting my EMS time, I have over 20 years and I've never seen anything of this magnitude. I've been through several other pandemics in times past. So it is quite stressful, particularly for those of us, our colleagues, who do have underlying health issues, but yet still need to work and take care of patients. And then our colleagues who may have family members at home who are elderly, more at risk, or have underlying health conditions. It's quite frightening.
So we're hearing a little bit about, well, we think this is leveling off. And today the governor came out and said that his medical advice that's coming to him still says that this executive order needs to be extended. I believe today he extended it until through May. Are you seeing a decline in your hospital right now, or do you think the levels still warrant the extension of this executive order?
Unfortunately, as difficult as what it is, I agree with the governor's decision. We have seen somewhat of a leveling off over the past few days to a week, but certainly we have not seen a decline, and we certainly have not seen a steady decline that would warrant a loosening of the current restrictions.
I think even today we saw an increase of patients on ventilators. That is somewhat of a guide to us that this is still ramping up, that people are getting worse. There are other treatments now they're using other than ventilators, so there's a lot of learning going on. Anything that we've learned about COVID in the past 40 days that we've really been drilling down on this that we didn't know when it started?
We've learned quite a bit in regards to the nuances of the critical care for these patients. Different manifestations of COVID-19, different complications. But I would stress that there is no miracle drug. The hydroxychloroquine and some of these other antiretroviral medications, they may ultimately be found to be beneficial, but it will not be a miracle cure.
When this all started, we were told, well, it impacts the elderly, the immune compromised individuals, but we're now hearing that the ages are throughout the spectrum, and even in younger adults, or at least in the 20 to 30 to 40 range, they're seeing strokes as a part of the symptoms of COVID-19.
Yes, one of the complications that we've recognized in the past month or two as an international medical community, that some of these patients are prone to clotting disorders. So we've seen patients who have had blood clots throughout their lungs. We've had abnormal heart attacks that have come in from COVID-related clotting, and certainly strokes would be along the same lines.
So can we drill into that a little bit? So COVID-19 impacts the lungs. It starts out in the body and then it moves to the lungs. Is that correct?
Yes, most commonly the patients who don't do well or become critically ill are suffering from lung disease.
And so is that a pre-existing condition or lung disease caused by COVID-19?
Lung disease caused by COVID-19. Certainly patients that do have underlying heart or lung disease or diabetes or cancer are at greater risk for developing COVID-19 related pulmonary problems. But this is this pulmonary pathology is something that can strike anyone of any age, any underlying health.
And so those are people who would not have had a stroke or not had that issue had they not contracted COVID-19.
Presumably so.
So tell us, is your system impacted? Do you still have enough capacity to handle where we are in the progression of this illness?
Yes, at the moment we are doing well. Overall, our ER volumes have drawn down as patients have appropriately second-guessed or questioned themselves, do I really need to go to the emergency department, as opposed to calling my primary care provider tomorrow. And that's good. However, like I said before, we are concerned that some patients are avoiding the hospital unnecessarily. But yes, otherwise, we still have good ICU capacity, PPE supplies, medications. Of course, that's something that the staff has to keep up with on a daily basis because it is quite dynamic, but so far so good.
And I believe the executive order today loosened up requirements that now people who have elective surgery now will be going back into the hospital system. And so hopefully that gets the message out that if you got problems, go to the hospital, go to the emergency room, get it taken care of. You don't have to fear contracting COVID-19.
That is quite correct. You do not.
Jeff, Doctor, we really appreciate you being here. Herb Simmons always has pointed questions, so now be prepared.
Okay. Well, and Doc, it's a pleasure to have you on the briefing today because with our friendship over many, many years. You're one of the most highly respected physicians in the Midwest, and I'm not tooting your horn. It's facts speak for itself. I've known you a long time. Just a couple of questions. Your history in the EMS field. When you came on board with that many years ago, it was a new shining light for the EMS pre-hospital care. You put a lot of new procedures in place and helped with that. Are you seeing that stress with this pandemic on our medics out there in the field, our EMTs? You're always considered like the father of all the medics. Are you getting any calls from those medics, maybe while they're off, saying, "Hey, I'm to my point where I'm ready to break"?
Not to that point, but certainly they share the same fears that our hospital colleagues do, bringing home this illness to their family members or perhaps contracting it themselves if they have underlying health issues. There's a lot of innate fear that we have to work with and reassure.
And you're seeing them more using the PPEs more than ever now.
Yes, absolutely. When this first evolved, it was somewhat hit or miss, but the pre-hospital providers seem to be consistently using their PPE now, which is excellent.
That's good. There's a lot of talk been out there about the ventilators. You need all these ventilators for this. Is that still the same theory that everybody's going by? I mean, not every COVID patient ends up on a vent.
No, that's quite true. The majority, in fact, do not. Even if they require hospitalization, only a small percentage will require mechanical ventilation. The issue is that if they do, they are so profoundly ill that they will require this ventilator for a prolonged period of time. These patients tend to add up, for lack of a better word, and that really dwindles the number of available resources such as ventilators that we would have available for others.
Okay. And one last question we get asked all the time. We see it, this is just the flu. Is this just the flu?
Absolutely not. So we all know that without widespread testing, we don't know what the true denominator is in regards to, we don't know what the true fatality rate is of this illness, but it will certainly be on order of a magnitude of tens of times greater than the fatality rate for a typical influenza virus. The other thing that is quite concerning is that as a coronavirus, it is an airborne virus. Influenza is typically spread by droplets. And what that means is that this virus is going to be considerably more contagious than a seasonal influenza.
Okay, very good. What would you say to our viewers that are watching this briefing now? What word of advice could you give them from your professional opinion?
From a medical standpoint, and I'm not an economist, I know it's terrible whenever there are people out there that are struggling to pay their bills and put food on the table. But from a strictly medical standpoint, I would continue to abide by these restrictions as long as you can. Sheltering at home, minimizing your gatherings. Certainly, even when the world does start to open back up, you must maintain distance between yourself and anyone else that is elderly or has underlying health conditions. These are on the last fatality rate that I saw for patients 80, 85 and up was 15%. That's incredible. So it's a true risk. Perhaps you're young and healthy, the risk for you is quite small. That's great. But you can spread this virus to others without knowing it whatsoever, and certainly without intending to, and those patients are at high risk of death.
Well, Doc, we really appreciate that information. It's always good to get it from the medical professions, and I really appreciate you coming in today and clarifying some of that information. I hope our viewers find that really interesting. Thank you.
You're quite welcome. Thank you for having me.
Thanks.
Thanks, Doctor.
Well, with that, don't just
Herb,
shake you.
we always have impressive advice from our medical community, and today is it really just sets it out. It says what we need to do, and so follow those rules.
I'm trying.
So we count on our medical community. We also count on our municipal government, our local government, to be able to make sure our police departments, our fire departments, our street departments, all of the things, the trash pickup, everything that we have every day has to continue to operate. Today, we're joined by Mayor Mark Kupsky from the city of Fairview Heights, and Mark is here to talk about COVID-19 and how Fairview Heights has responded. to this pandemic. Mark, welcome.
Thanks, Chairman. Glad to be here today. So, two things first. First, I want to say to our viewers, thank you for those who are practicing the stay at home and the social distancing. So that is absolutely critical to us getting past this terrible pandemic that we're facing. We heard Dr. Schaefer talk about the impacts to the communities. So please take this very serious and continue to do that. And next, I want to say thank you to all of our first responders, our police department, firefighters, EMS, and all of our healthcare workers for the job they're doing. You may not realize it, but every day they're putting their lives on the line to make sure that we are safe and healthy. In addition to those, think about the people that are supporting their daily functions. The housekeeping staffs, the building maintenance staffs, the people preparing the meals for all of our first responders and healthcare workers. And so we want to say thank you to all of you for the outstanding job you're doing to also help all of us stay safe. So, Mark, this is a terrible disease. As a municipal leader, we certainly feel the impacts. Fairview Heights, being one of the retail centers of southwestern Illinois, certainly is feeling that. As we know, that most of the retail stores and the malls and things are closed, and our restaurants have adapted to doing curbside and carry out. And with the governor's new changes, some other stores will be adapting to how they do things a little bit different. So thank you for those who are supporting our local restaurants and businesses. These are tough times, and these tough times will continue. The city of Fairview Heights certainly feels the effect of those times because we rely heavily on sales tax. And as a result, that's going to make some changes not only for our city, but I think I speak on behalf of all of the local municipal and civic leaders that we're going to have to do some things a little bit differently. You will likely see some changes in public services. I don't care whether you're in Fairview Heights or East St. Louis or Belleville or O'Fallon or Mascout or other cities. We're all going to have to learn to do some things a little bit differently. We have had to impact some of our employees. We furloughed, Mark, about 130 employees, primarily employees at our rec center, library, and other what we would consider non-essential. Certainly, we've kept all of our emergency services people and the city hall. While the building is closed, we're still providing all of our services. We're doing most of that remotely, and we appreciate everyone's understanding and hard work during the time that we do this. So, it is different times. They will be different going forward, and we all hope that if we all work together and first of all practice those safety measures I talked about, that we can get our economy back to some form of normality, certainly different than what we knew prior to March.
So, Mark, many people might not know you don't have a property tax levy in Fairview Heights. So people pay their property tax bill, and Fairview Heights government doesn't rely on property tax. And I think you're the only city in the county that's like that. But what that means is you're very dependent on sales tax. And you've got a lot of business, the mall and all of the retail that you've been really good at attracting and keeping, which is not an easy task, not only during this time, but any other time. So how you've got, I assume, you've made some adjustments in your budget, but like the grasshopper and the ant, you've been saving up over the years. And so I think I can be comfortable in asking you the question, do you have the reserves to be able to make it through what we now envision as the end of the year, or at least that's how long we're going to be impacted by this?
Sure, great question, Mark. So we are one of two cities in the state of Illinois. The city of Fairview Heights and the city of Schaumburg are the only two cities in the state that assess no property tax, municipal property tax on residents. So we do rely on sales tax. We do rely on food and beverage tax. So we have been very prudent on our spending over the years and our budgetary process. And as we've all seen over the years, that retail sales have changed, especially with online sales. We've made those adjustments. So we did do some planning for what we would call a rainy day. We have built some reserves, so that will enable us to continue operating. We know there will be delays on sales tax revenue from the state as those things flow in. And of course, lack of that right now because retailers are not open. So we are doing some budgetary planning now. We approved our city budget on Tuesday, a very bare bones budget to keep the doors open and lights on and provide basic services. And we've taken out things like travel or new vehicles and we are going to delay some road projects and things that we have to ensure that we can provide the basic vital services. So again, certainly we are working hard to make sure that we are spending every dollar as efficiently as we can, and we'll continue, as always, to look for new ways to find revenue sources and to provide for our residents. And most of all, we are advocating to our state and federal legislators to provide help and assistance to local municipalities. Currently, the stimulus bills that have been approved are not providing anything down to the local level. So we understand that's coming, and with the hard work of Senator Belt and Representative Hoffman and many of the others that represent us, we're certain that we will see the help we need as local municipalities.
So when we get our audits done, the auditors always comment on reserves. And many times you and I know that there are people who will say, why are you keeping a reserve? You should, if you have more than what you need to operate during the fiscal year, you should either give that back or not have that reserve. These are times when, now here's why you have a reserve and why the auditors have really not only recommended but strongly recommended 6-month ability to be able to pay all of your employees and cover the expenses just in case of a pandemic, something we never expected.
I think, we never planned really for a pandemic. I think we looked at things like for Fairview Heights, what if the mall would have a fire? Or what if we'd have a tornado? We had a tornado that went through our central business district years ago. And I don't think any of us ever anticipated we would have an event that would force us to not be able to go out to local stores or retailers, and that would shut down large things like the mall. So absolutely, that planning is critical, and then always watching your budgetary needs. Just like in our own personal lives, we should plan ahead and make sure that we have enough available to us to cover those emergency times. So I think we will continue to do that smart business planning, and like the county, we have worked really hard to ensure that over the past several years.
Mark, you're progressive, you're proactive, you're involved in your community. Fairview Heights is lucky to have you at the helm during a crisis like this. And I'm going to now turn it to Herb Simmons and see if he's got a question to try to trip you up, because I haven't been able to do it yet.
All right, thank you, Chairman.
Mayor, thanks for coming in today. I just wanted to say your police department, fire department, we have those weekly calls with them, and they've been great. The chief, CJ, anytime we've needed anything, we've called them. In fact, they've even appointed Lieutenant Kitley, I think, to handle any of those complaints of people not wanting to adhere to the executive order, and that really helps us out when those calls come in, either to our 911 centers or to the EMA here. So I want to just, if you would relay that message to the chief and them, that we really appreciate it. And we have CJ on speed dial, so but thanks for coming in. We really appreciate that.
Good. And Herb, we thank you and the county and Brian for what you're all doing to communicate to the public across the county, including Fairview Heights and local municipalities. These updates are really important. And thank you for your 24/7 hard work, as always.
Thank you.
What you do for the county.
Zip codes.
Zip codes.
See
if you weren't here. All right, so today we're going to go over the zip codes. Remember, if your zip code isn't red, doesn't mean that you don't have a COVID positive diagnosis in your zip code. It just means that hasn't risen above the level of 5 in your zip code yet. So starting off with 62201, 8, that number stays the same. 62203, it continues at 11. 62204, there remains 9. In 62205, there's an increase of 1 to 12. 62206, there are now 31, that's an increase of 1. 62207 remains the same at 18. 62208 remains the same at 22. 62220 sees an increase of 4 up to now 30 residents that have been diagnosed COVID positive. 62201, there are now 31, that's an increase of 2. 62223, there are now 22, that's an increase of 1. 62226, there are 52, that is an increase of 1. 62258, there are 12, that is an increase of 1. And 62269, there are now 28, That is also an increase of 1. So, Herb, we're seeing the numbers continue to rise in all these zip codes. Our long-term care centers are seeing issues, so we just got to remain vigilant.
You're right, Chairman, and Sam, you heard the numbers from her. 826 positive cases across the state. 123 new deaths, and as I say every day, that's 123 people over the last 24 hours that died alone. You've heard for many of our medical people that's been on here and our hospital personnel, the visitation at hospitals are restricted. So when one of your loved ones ends up in there from the COVID, they're going to be by themselves, and that's something you got to think about. On the EMA report, busy day today, conference calls with IEMA concerning PPE orders. We got a small shipment today, expecting a bigger shipment tomorrow. We got that call about a half hour ago. So for our first responders, you'll be getting another email from us. Mary, you'll be seeing another one come out from Brian and Randy, and we'll get them taken care of. I had a conference call with Senator Plummer, trying to chase down some gowns from him. A conference call with the public health agencies. So a busy day with the phone calls. But you hear Chairman Kernan and all of us sit here and say, just like he did, we got to stay focused. We got to do what the governor's executive order is saying. For those of you who continue to sit out there and say this isn't real, Dr. Schaefer, you just heard what he said. Well-respected physician in the Midwest said this is not the flu. So it's time you doubting Thomases stand up, step up, stay home so other people can stay alive. We'll see you back here tomorrow about 3:30 p.m. for the daily update. We'll be back momentarily with our young lady to interpret this into our Spanish communities. Thank you.